This Focus on Health segment is brought to you by Aurora Health Care.
Hi everyone, I'm Connie Carmical and welcome back to Oshkosh Today. When you become ill, you have the right to say yes or no to treatment options. Here at Aurora Medical Center in Oshkosh, that is the basic philosophy of care. But what if you became unable to decide for yourself? Who would speak for you, and would they know what your wishes are? You can take steps now to make sure your wishes are known. On today's Focus on Health, we meet up with Dr. Kevin Green and Lori Gunther, who run a program called Advance Directive here at Aurora Health Care. Well, thanks so much for joining us. Now, Lori, tell us a little bit about Advance Directive. Can you walk us through a little bit of that?
Sure. There's a couple different kinds of advance directives. One is a living will, and another is a power of attorney for health care. Aurora recommends the power of attorney for health care because it selects an agent that speaks on your behalf. And regarding health care, it's not always black and white. So it's really best to have someone who is familiar with your wishes and that you select that person who, again, can speak on your behalf when you aren't able to speak for yourself.
Okay, and I understand we have it's a packet of information. When you come to see your primary care physician, they give you this packet of information that answers all your questions. Let's go through a little bit of that. Tell us a little bit about that.
Sure. The packet that Aurora has, it's in one envelope, and it contains an informational form that is called For Your Wellbeing, and it addresses several different questions about advance directives, why you would fill one out, how to talk to your loved ones about, some difficult questions that do arise when filling out your advance directive, and then also the document. The document does look a little bit, a little bit ominous because it does seem a little bit long. But once you get into the meat and potatoes of the document, it really goes pretty fast once you've read it and really know what to do. And I really recommend that you complete an advance directive when you're not in a crisis situation,
right,
when things are going pretty well or you're in for a complete physical, and you can really sit and think about what you want. And I really hope that people can have a different mindset about advance directives. And it's not so much about how I want my life to end, but how I want my quality of life to be if something traumatic might happen.
Sure, and that's where it doesn't matter what age you are. A lot of people may think that you have to be older to do this.
That's correct. The document is legal if you're 18 and older.
Okay.
You can complete the document, and we certainly advocate for young people to complete their document. An example that I do use is the Terry Schiavo situation.
Sure.
She was a young person when she had a cardiac event, and she was in her 20s. And a lot of people think, well, in my 20s, nothing's going to happen. But you never know. And again, it's how do you want your life to be and your quality of life to be if a situation were to arise where you can't speak on your behalf.
Right. Well, that's good information. And if anyone would want more information, they can always log on to Aurora's website at aurorahealthcare.org. Thank you.
You're welcome.
Okay, Dr. Green, so why don't you tell us, why do you think people need an advance directive?
Well, I think everybody needs an advance directive. As Lori was saying, even if you're 25 and in excellent health, you can still be in a car accident, you can still become incapacitated, slipping on the ice. And why we need that is healthcare professionals, as we try and treat someone, we need to have their permission to treat. And if they're unconscious or not able to tell us what their wishes are, then we have to try and go to family members, try and get other sources of information. Sometimes,
I'm sure it saves a lot of time, too.
Well, that's one of the big points, is
mm-hmm.
if we don't have that power of attorney, we sometimes have to go to the court and have a court hearing. It's expensive, it takes time, and it might delay critical treatment that the patient needs to have.
That's true. And then what happens if they do not have the advance directive?
Well, like I say, a lot of times it's a very stressful time for the family, and one might feel that mother or father wanted this, the other one might feel no, they wanted this. Getting back to the Terry Schiavo incident, there was a lot of disagreement, a long time in court. It can delay critical treatment. It can make things much more expensive. And maybe the ultimate is the patient, won't get what they wanted to have or not have done.
That's true. That's true. And I understand you can pick these up not only at your primary care physician, but any Aurora Health Care?
That's correct. There's several sources, and the main thing is once you get one, fill it out and get it back to us.
Okay.
It's no good unless it's signed and filled out and done properly.
Okay. And do you suggest making copies and maybe keeping it at home, keep a copy for yourself and give one to your doctor? And
we need one here,
okay,
but I would recommend that you keep a copy for whoever is your power of attorney,
okay,
and probably you should have one at home too.
Sure.
But the main point is a lot of people want to put this in their safety deposit box or have their lawyer's office, and when we need them, we might not be able to access that information, so your doctor really needs a copy of this.
Sure. And I would think that it would also be a good idea that when you're filling it out is to let your family members know what your needs are and everything as well, instead of being surprised that you did this later on.
That would be not a very nice surprise. So
No.
I think definitely you want to involve your family members and get their permission to say, will you be my power of attorney, and educate them a little bit about what that means and what they might be asked to do in the future. And that's a good time to discuss this and say, this is what I'd like. If I become incapacitated, this is what I want done or what I don't want done.
Mm-hmm. Okay, great. So it's a great thing to make sure to get all your family involved and make sure that they all have one as well.
It's difficult to talk about, but you need to talk about it before it happens.
Okay, all right. Well, thank you both so much for joining us.
Thank you, Connie.
Thank you.
So remember, it's a great idea to get your Advance Directive and keep it in a safe place. For more information, you can call Lori here at Aurora at 303-8700. Don't forget, you can log on to the web at www.aurorahealthcare.org. Thanks so much for joining us on this Focus on Health.
This Focus on Health segment has been brought to you by Aurora Health Care.